Pennsylvania Acting Secretary of Health Klinepeter received a tour of Evangelical Community Hospital on Tuesday from CEO Kendra Auker.
She's a big supporter of rural health care and community hospitals, so she came here. We spent some time talking this morning. She met with my executive team and a few other individuals who were key during our pandemic operations, and we talked about that. She took a tour of this new Prime facility and some of the other parts of the hospital.
So EVAN is one of the most innovative hospitals that I've had the privilege of getting to visit with recently. I really admire not just the investment that they've made in the physical infrastructure, which is extraordinary. I mean, this is a beautiful, world-class building, but also in their people.
One of the biggest obstacles facing community hospitals is the lack of healthcare workers, which is one of the issues that Klinepeter did address.
Yeah. Well, I think it continues to really come to the forefront and surface that we need to invest in our healthcare workforce as well as our healthcare infrastructure. So as you know, the governor has proposed the use of $1.7 billion from ARPA, much of which would be invested in healthcare workforce and recruiting and retaining them in Pennsylvania. So the Department of Health has several visa programs that we provide to particularly international clinical types to recruit and retain them into our rural communities. Every year, though, we are not able to fulfill all of the requests that we have for that opportunity. And so certainly with additional funding, we could expand that type of a program. But beyond that, honestly, I think we're in a phase right now of really talking to the hospitals about what they would like us to do. I certainly think that oftentimes the best messenger in the community is a local messenger. And so whether it's Kendra or Representative Wieland or other leaders from within the community, they're really the best positioned to really go and speak to young folks or to employ strategies that they think will work for the community. And then I really view it as the department's role to listen to what they think will work best and then support them in any way we can. And I think we also need to allow for the investment from an infrastructure perspective so that other hospitals are able to build world-class facilities like this that really are intended to meet the community need. And I think that was something Kendra and I really both resonated with is, building to meet the community need, not building for the sake of building.
Hi, my name is Rick Dandis from the Daily Item newspaper. What are some of the other challenges that rural facilities have? It seems to me transportation, how to get to a hospital would be one. Is there anything that the state can do about that?
Yeah, so transportation is one. I think broadband is another. And the ability of either the facility or those patients in their home to access care via telemedicine if they don't have access to the internet. So I think there are a lot of interesting programs that hospitals have established either before the pandemic or through the pandemic that are, van rideshare type programs. I know for many hospitals that was hard to sustain during COVID because they had to redeploy those team members to be able to provide other services such as helping at vaccination clinics or testing sites and the like. So certainly we're interested in any way we can support hospitals in providing that transportation. And again, I think that's something we could look at from an investment perspective.
Speaking of challenges, what were some of those that you're hoping to, share with the state?
So I think really the intent today was really just to talk about the way things unfolded. And I think, it's always a learning experience to hear someone else's perspective on why things occurred. So, you hit a crisis moment in time and you're sitting around saying, what are we going to do? We need to move quickly. We have to respond. You look to the state for certain things. They look to you for certain things. Are there ways to improve communication? Are there services where we didn't feel supported? What are the challenges? But what's the vantage point, from the other side of the aisle, so to speak? And I think that was the beauty of the conversation, was to just sort of go step by step with the way sort of our process unfolded here. We're not part of a big system, so we don't have a lot of depth, so to speak, to go out. It was, you were on your own, basically, and you figured it out. And we would work with the state on certain issues. But I think, the value to me, personally, was just the ability to have a conversation and to sit down face-to-face with the secretary and say, here's what it felt like, and have my team say, here was an experience we had. We think this could go differently in the future, or this worked really well, or, that type of thing. I just think that it's always the right way to handle a circumstance is to sit down face-to-face and talk to it, and it was such a rapid-fire, constant movement kind of process for the last 2 years that it's nice for both of us to just be able to sit down and have a conversation.